Well, a warm welcome to today's talk. It's Monday, the 31st of January. Now, I've got a fascinating calculator to show you from Australia that estimates your chances of dying should you become a case, that is, should you be diagnosed. And of course, we know infections are higher than cases. But if you become a case and you're diagnosed, what your chances of death are. And for my age group, with my vaccination status, without considering comorbidities, my chances of dying at the moment, if I become a case, it looks like it's 0.014%. So that looks like the risk for me, but I'll show you how to work out the risk for you as well. Really quite interesting. Before we do that, cases are going down in the UK, but they're levelling off. We're not carrying on going down, whereas in the States, they are carrying on going down. It's looking really quite promising in the States. So let's look at some of that data here. Now, here we see the cases in the States going down. No question that they are going down. But that's for the United States as a whole, of course. And Dr. Tom Frieden, former director of the Centers for Disease Control, more optimistic than any point since the pandemic emerged. He's got the tools, not the Toots. He's got the defences and he's got the information. Best chance to keep and get the upper hand. Well, I'm not sure I actually agree with this. I think we've been remarkably fortunate with Omicron giving us this herd immunity at relatively low cost in terms of hospitalization. Now, of course, we needed the vaccines, but it's a very real combination of the Omicron coming to the rescue in combination with the vaccines rather than us just being clever, because we haven't been that clever, really, to tell you the truth. But let's carry on looking at this data. So that top one there was the United States as a whole. Now, New York was infected first, so it would actually follow that it would get better, that the numbers would go down quicker. Now, these numbers here were just off the scale, so I haven't included them. But we do see the numbers are going down quite dramatically. Likewise, District of Columbia was infected at an early stage. So again, if it's infected at an early stage, you would expect herd immunity to develop more quickly and the numbers to go down more quickly, and that's exactly what has happened. So this is really remarkably encouraging. So Washington, D.C., again, nice reduction in cases. But of course, what we need to know about is the hospitalizations. So here we see the US hospitalizations as a whole, and they are starting to go down, which is excellent news. They are starting to go down. As the cases go down, the hospitalizations go down. But again, let's have a glance into the future for the whole states. New York hospital admissions, well, they've gone down really quite dramatically. Very good reduction there in hospital admissions in New York. And then if we look at hospital admissions in DC, we see a similar reduction in hospitalizations. Probably see it better without me, of course, if I can do that, which I'm not sure I can at the moment. Yes, I can. No, I can't. Never mind. So District of Columbia going down in all ages there, which is encouraging. Now, US patients actually in hospital at the moment is slightly different. So these are patients actually in hospital now, and we do see a slight reduction. There's a slight reduction there. 9.1%, in fact. So that's not bad. That's a 9.1% reduction, which is great. And it's on the way down. New York patients, though, actually in hospital, well, we see a 24.1% reduction on the week, which of course is absolutely excellent. 24% reduction in the week, and there's no reason why the rest of the United States shouldn't hopefully following this trend. Now, let's carry on. I think we've got the same information from District of Columbia and New York. So that's New York patients in hospital. Yep. DC patients actually in hospital. And again, we see a nice gratifying downward trend there, which is pretty good news. Now, the United Kingdom, whereas things seem to be flattening off really quite quickly in the United States, or going down quite quickly. In the UK, it's more flattening off. So the United States seems to have shot up and then shot down again. In the UK, we shot up. We've shot down a bit, but it was kind of more kind of rumbling along in the UK. I guess we've got more herd immunity to catch up on in the United Kingdom. That could partially explain that. But let's just look at the United Kingdom data now, which is here. UK data. Now here we are, 7 day case rates by specimen date. So yeah, so we just see it was going down quite nicely, and now it's basically leveled off. So the number of cases is fairly level in the UK, whereas in the States it seems to be carrying on going down. Now, I'm confident that it will carry on going down shortly. But interestingly, on the COVID symptom tracker data, which of course is more up to date than this, there's actually been a slight increase in symptomatic cases over the past 3 days, 3 or 4 days. So we could well get a small increase in cases in the UK just for a period of time. Then the herd immunity will develop and it will start going down. But for that period of time, it's a little disappointing. And it would hope to be a much more quickly up, quickly down like South Africa, quickly up, quickly down like New York, quickly up, quickly down like District of Columbia. But it's not. We're more kind of leveled off in the UK. You don't want to see me anymore. I want to go on to that one. So patients in hospital in the UK, though, gone down really quite progressively, I think would be the word there. They're going down progressively. Now, this is the Australian risk calculator. Now, I'm just going to show you this. I'm going to show you this graphic now, hopefully, which is here. There we go. Oh, come on, let's see you. I'm actually working out of town today, so the technology is a little bit, well, it's quite a lot different, really. So this is the Australian risk calculator. Now, this is remarkably interesting. So this is based, as we say, this is based on data from quite a few places, and we can actually see it's actually based on assuming that there's 90% cases of Omicron and 10% cases of Delta. So it's kind of transition period data. But you can look at the top there and see your vaccination status. So here we see our vaccination status along the top. There we go. We've got more of it on now. Not quite. Anyway, so you've got vaccination status along there. You can see your age there, and you can work out what your risk is. So if we take here, for example, if we take a woman who is, let's say 40 to 49 years old, after 2 doses of AstraZeneca, this is 2 to 4 months after the second dose, it's not 0.3%, it's 0.3 per 10,000, which is 0.03 per 1,000, which is an overall risk of death in that situation of 0.003%. So that is quite a useful table. Do check it out for yourself. Do look yourself up. And there's actually as well as the table, there's a calculator on there as well, where you can actually put in all your data and calculate your calculate what your risk is. Now let's go back. I've got some interesting comparisons here from Australia, actually. Yeah, here we are. So this is really quite interesting as well. Sorry, this is me with technology issues. There we go. Yeah, they put these on as comparators in Australia. So event. These are quite interesting. Can you see me as well? There we go. I'm back. Yeah, so chances of winning First Division Powerball Lotto in Australia, 1 in 134 million. Chances of giving of any given pregnancy resulting in identical quadruplets. God dear me. Chance of being in a fatal shark attack in Australia, 1 in 8 million. Chances of dying from being struck by lightning, the estimate 1 in 4 million. Chances of winning First Division Powerball Lotto, I think we've done that one, haven't we? Lifetime chance of dying by drowning in the bath, 1 in 685,000. Chances of dying by assault a year, dear me, 105,000. Chances of any given sky jump resulting in death, 1 in 100,000. It's just chances of being killed in a car accident in a year in Australia. Wow, 1 in 18,000. Chance of being killed in a car accident in Australia, 1 in 18,000. That's pretty high. Wow. Lifetime chance of dying on food, choking on food, 1 in 5,000. So it really kind of puts these risks into kind of perspective, really. These are risks that we live with on a day-by-day basis. Chances of any given base jump resulting in death, 1 in 2,500. I'll skip on that one. Chances of being diagnosed with cancer in Australia in the next year, 1 in 200. Quite sobering numbers. Chances of being hospitalised from a fall a year in Australia, 1 in 100. Chances of receiving a speeding ticket a year in Australia, 1 in 12. The police are very strict in Australia. Chances of getting food poisoning a year in Australia, 1 in 6. Lifetime chance of developing shingles, 1 in 3. So I think that helps put this in some sort of a context, really. So I think I might leave that there because I've got slight technological problems today. I have got some more interesting information about the confusion around deaths from the Office for National Statistics. There is still some confusion. The overall figure for excess deaths in the UK is probably about 127,000. And the Office for National Statistics estimate it's probably about 140,000. They're estimating 9 out of 10 people where COVID-19 is on the death certificate actually genuinely did die of COVID rather than with COVID. But more on that debate tomorrow. We'll leave it there today, and thank you for tuning in.